Um, I'm here with Dr Joanna Christou from the Cosmetic Skin Clinic, and we were going to have a chat about treating the older forehead.
Yeah.
Older being 55 plus?
Yes.
Because the thing that people would first think of for treating a forehead, where you see wrinkles and lines setting in, would be to use injectable toxin to relax it. But you were saying there's better ways of managing it than that. So could you tell me a bit about that?
Yeah, there are multiple considerations when treating the upper part of the face because, of course, relaxing the muscle with toxin, it does just that. But the anatomy is far more complicated than just the muscle.
Okay.
And so consideration needs to be given to the fact that the aging process is multifactorial, and so therefore there are other elements of the anatomy that may be contributing to lines on the forehead, for example.
Sure, so when you say other elements of the anatomy, is that like the way we're losing bone from the brow and fat pads?
Exactly.
Okay.
So the bone as we age resorbs, so it changes its contour. There is fat in the upper part of the face, and we commonly now talk about fat in the temples.
Yes.
But there's actually fat through the forehead as well, and that depletes as we get a bit older.
Okay, so because with the temples you get that kind of hollowing, don't you? That it can really soften the look to put some filler in there.
Yeah.
But so do you actually inject filler across the forehead as well?
Exactly, and the area in the forehead that has the majority of the fat is above the lateral brow here, and so you can see a kind of a skeletalization, as it were, where the bone becomes more visible, more prominent, and so the face looks a bit harsher and it sort of collects a shadow, whereas if you use a hyaluronic acid filler, for example, to replenish that, you can just soften that contour, and what it does is it supports the upper part of the face, and therefore light bounces off, it reflects off, so you look brighter and healthier and more youthful.
How clever. So it's getting that contour back, so it's quite a subtle thing.
Yeah, so its role really is in combination with relaxing the muscle, because the muscle is the one element, but the fat underneath that supports the muscle. So in other words, if you can do a well-placed filler in this area underneath the muscle and then gently relax that muscle, that combination approach gives a much more natural result, because it means that you do kind of a light sprinkling Botox rather than be tempted to over-relax the muscle in pursuit of removing lines.
Sure.
And so it keeps the dynamics of the anatomy. It's much more respectful of the fact that the anatomy is complicated, much more complicated than just the muscle that's there. Yeah.
Okay, fab. And then once you've done all that, is there a role for skin tightening treatments on the forehead, things like ultrasound and radiofrequency, which I ask because I know the clinic has got the exclusive on the Ultherapy brow lift at the moment, hasn't it?
Exactly. So that's the final triad of considerations, if you like, the other elements of the anatomy. So once you've underpinned the structure, the scaffolding with a hyaluronic acid filler, once you've gently relaxed the muscle on top of that, the third element is the overall kind of soft tissue integrity, so the collagen, the tight sort of springiness of the skin, and therefore ultrasound tightening with an Ultherapy brow really kind of brings everything together, and that then will be the gold standard of treatment in the upper part of the face.
Okay, because that's tightening the skin but also stimulating new collagen growth, isn't it, to hold it up better. Fantastic. Okay, so we've got all those three there, and that sort of will pick the brow up as well, because droopy brows tend to look very aging, don't they? But this is going to address all of that and get it all looking just really nice and natural.
Exactly, and the droopy brow, most people, as we said at the beginning, will automatically think of toxin, but toxin alone will be limited or increasingly limited with age as a standalone modality. And therefore, when you take this kind of holistic approach, really assess the anatomy, have a look at which elements are playing a role, and combine these different modalities of treatment, you get a much better result, much more reflective of one's natural anatomy, because you're not augmenting or distorting the structures, you're simply preserving and restoring what naturally existed in youth.
It's complicated, which is why you need an expert practitioner.
Yeah.
Dr. Jo, thank you so much. That was
a pleasure.
really, really interesting.
Nice to see you again, Alice.
And you.